My name is Dr. Curt and I'm the owner and clinic director here at Focus on Health Chiropractic. There's a lot of different ways to practice chiropractic. We practice it from a sports medicine perspective, so we treat orthopedic injuries, sports injuries, chronic degenerative pain, all sorts of different acute pain, but there are several hundred techniques and several hundred approaches to chiropractic care, and that's partially exciting because you have a lot of autonomy, but it's also nauseating because there's no direct standard of care either. So we take our evaluations very seriously, and we want to make sure that we can help our patients walk through the door. We get people that pop in with low back pain or hip pain, and commonly it's not the low back or the hip's fault. It could be an ankle mobility issue that's causing a knee stability issue that translates on up into the back. So we want to make sure that we have the right tissue before we start treatment as well. We utilize orthopedic evaluations very similar to our sports medicine colleagues to make sure the tissue that we're going to be treating is appropriate. We utilize the selective functional movement assessment and the functional movement screen as our primary evaluation tools. Each of these tools look at individual joint systems and how they work, and then more importantly, how all the joint systems work together as a whole.
I'm Dr. Ryan at Focus on Health Chiropractic. So manual adjustments are what you typically hear about chiropractors doing, their snap, crackle, pops, okay? When we go and do that, it's not that something's out of place. What we're looking for is any joint restriction. We're trying to allow the joint move through the whole range of motion. And what the adjustment does is really helps us get that mobilization a little bit quicker. It's the quickest way to get a muscle to relax, especially if we're in a nice little spasm. So Graston is an instrument-assisted soft tissue manipulation tool. Basically what that means is it's using some either form of an object that's a metal object, whatever it is, that's typically the one you'll see. What we do is you kind of rub over the muscle. Basically what happens, it's really good for extremity issues, any swelling, soft tissue insoles, scar tissue. It breaks all of this stuff up. Bursitis respond exceptionally well to it as well. You're trying to deform the tissue a little bit by being a little bit more aggressive.
Dry needling is more of a westernized form of acupuncture. It's typically utilized to release trigger points, and so we use an acupuncture needle or a closed filament needle to stimulate these trigger points and try to get the tissue to release. It's super important that we keep the area clean and sanitized, so we utilize alcohol prep, and then also the patient's presentation history. So if they have comorbidities like severe diabetes or something of that nature where they're prone to infection, it might not be the most appropriate tool for them. But most people respond to it very well. Even though it's the most aggressive therapy that we offer in the clinic, it is still extremely conservative compared to other injections, surgeries, etc. There's a few different goals from a dry needling appointment. One of them is to release a trigger point, as we talked about. The other sometimes is to stimulate an underactive muscle, or what we call a hypotoned muscle. So quite commonly, the glutes are muscles that don't function very well, and we'll stick a needle into a trigger point or just into the muscle tissue itself, and then we'll utilize a little pointer e-stim unit. It's a lot more potent than your standard e-stim because transdermal or TENS unit e-stim has to be a sticky pad on the skin. It has to go through all those layers before it hits the muscle. With needles, it's already in the muscle. It's a much more potent contraction. We have to use less of the stem to get the desired result.
My name is Kristy Tiesing, and I'm the movement specialist at Focus on Health. So Movement RX is a program that takes place in our movement lab in the clinic. All of our active care patients graduate to a functional fitness program when they're done with their active care, which means they're out of pain and ready to get back to whatever they do in life, whether that's play with kids, run marathons, just work out as a hobby. What we do is make sure that they can return to those activities safely, and we supplement what they're doing, or some people make it their gym home and come in 2-3 times a week and just train personally with me. The idea behind it is to kind of empower the patient to take their healthcare into their own hands. A lot of injuries, a lot of pains, a lot of illnesses can be avoided just by a healthy lifestyle. So the idea behind the functional fitness class is to support a healthy lifestyle for them, teach them some movements in the gym that are tailored to their individual needs, and then allow them to basically take that and run and live a better, healthier life.